Welcome to Friday Friends, RI Elder Info's weekly look at the organizations and individuals providing resources for Rhode Island seniors, caregivers, and professionals.
Good morning, everybody. Happy Friday. It is a fabulous Friday today. I'm so glad that the weather has finally broken. My goodness, I'm tired of the cold and the snow. Well, as you all know, this is Friday Friends, and I am Deb Burton, Executive Director of RI Elder Info, where every Friday I bring you information that you or someone you know needs to know about. So please hit the like button, the share button, the follow button, the bells, the whistles, all those social media cues that say, hey, check this out, because my conversation today is with Nina from the Economic Progress Institute, and we are going to be discussing some of the impacts to expect from HR1, also known as the Big Beautiful Bill. And it is something that is probably going to touch the lives of someone you know. So please help us get the word out by sharing it. And I am strongly encouraging you to speak with your friends and loved ones about this, because this is something that's going to be really impactful for many Rhode Islanders. Now, as you all know, we are a 501c3 nonprofit, and we could not do this without the support of our sponsors. So a huge thank you to United Healthcare, as well as all of our individual donors, and McCarthy Law. McCarthy Law is a regular sponsor of Friday Friends, and here is a message from Samantha and her team.
Here at McCarthy Law, we practice in the areas of estate planning, long-term care planning, elder care law, and residential real estate. Our focus is really on providing peace of mind to our clients.
If you're interested in scheduling a consultation with our office, you can feel free to reach out to us at 401-541-5540. You can also reach out via website at www.mccarthylawri.com. You also should check out our social media, both on Facebook, Instagram, and LinkedIn, for some helpful tips and tricks.
Welcome, Nina Harrison from Economic Progress Institute. How are you today?
I'm doing well. Thank you so much for having me.
Yes, I am so glad that you were able to come on today. Can you please tell everybody, what is the Economic Progress Institute, sometimes called EPI?
Sure. The Economic Progress Institute is a nonprofit organization. We've been in existence for about 26 years. We do policy research and policy advocacy in Rhode Island. Essentially, we advocate for laws that benefit low and modest income Rhode Islanders and improve economic opportunity and equity throughout the state. We are basically lobbyists for the people.
Oh, I love that. And just for clarity, when you say that you're lobbyists for the people, do you take money from one direction or the other to promote red or blue one way or the other?
No, absolutely not. Much like you, we are a 501c3 nonprofit, which means we are 100% nonpartisan. We don't advocate for red or blue policies. We're just trying to advocate for policies that benefit average, everyday, working Rhode Islanders and vulnerable communities.
I love it. I love it. It's power to the people, it sounds like.
Yes.
Awesome. So last 4th of July on Independence Day, HR1, or the Big Beautiful Bill, was signed into law, and it's huge and it's confusing, and it's the new federal law. And for older adults and caregivers who might not actually follow federal policy closely, what are some of the most important changes in the bill that people should understand right now?
Sure, you're right. It is a really big bill with a lot of stuff in it. I don't quite think it's beautiful, but it really comes down to two parts. There are tax changes and then there are benefits changes. And essentially what HR1 did is transfer $1 trillion worth of federal funds that would have normally been going to fund things like healthcare, Medicaid, and SNAP. It removed that funding from states and instead used it to pay for tax breaks for the wealthiest Americans. And so in Rhode Island, that means that the top 1% of income earners in Rhode Island are getting an average tax break from the federal government of $58,000 this year. And what that also means is that because the federal government cut Medicaid and SNAP funding that would have been coming to the state, that 53,000 Rhode Islanders are expected to lose health insurance. And up to 14,000 Rhode Islanders are expected to lose SNAP benefits. So pretty significant.
So each of the top earners get an extra $58,000 annually, while some of the folks who are the most neediest will possibly lose access to food and healthcare.
Yes, that is correct. That 58,000 is on average because obviously people in the top 1% earn different amounts, but on average, it will be a tax break of $58,000 this year. And that is a permanent tax break. That is, again, why the federal government cut so much funding from SNAP and Medicaid, is explicitly to pay for these tax breaks indefinitely.
Whew, okay. Not okay, but it is something that we're all going to be dealing with. So how could the Medicaid changes in HR1, some of the things that I'm hearing about are work requirements, more frequent eligibility reviews, maybe even cost sharing. How can those affect older adults and family caregivers in Rhode Island?
Right. So first thing, I'll give you a big number, which is that in fiscal year 2028, because of these federal cuts, Rhode Island is looking at almost $400 million in combined state and federal Medicaid funds that it would have otherwise had to spend, but won't because of the cuts from HR1. And so whenever that much funding is cut, you can expect that some programs will be cut as well. And while we don't know what those programs will be, it's very possible that some of them could be involving home and community care that elders rely on to age in place. The other thing that's going to happen, as I mentioned, is of the 53,000 people that are expected to lose health care, about 33,000 are expected to lose Medicaid. And so that's from a combination of people who are no longer eligible and people who maybe can't comply with work requirements. The second, these are really scary numbers. I hope not to be this depressing the whole interview.
But we want to deal with facts and not fear, because if we don't know what to expect in the future, we can't plan for it today. And so, by providing accurate information, people can make the decisions that best work for their life, so that it's not a matter of going forward in fear, but with information that empowers you to do what's best for you and your family. So I appreciate it, even though it's stunning, it's important. So please keep going.
Right. Thank you. I think to your point, there are still things we can do. So that's the not depressing point I'm hoping to get to. There are still things we can do and that the state can do to mitigate this damage. And there are some great healthcare proposals, but the bottom line is even the best proposals can't make up for nearly $400 million in missing funding. And so one of the top things that we're encouraging the state to do is to raise revenue fairly by taxing the top 1% of income earners in the state, those who have been getting the will be getting the $58,000 tax break from the federal government. We're trying to divert some of that back to the state. And that would, if it passes, that would raise $203 million a year in revenue for the state that we could use to make up for some of this lost Medicaid and SNAP funding. It would only affect 6,100 tax filers in the state. And again, they've been getting these tax breaks since 2017 when Trump passed his first tax plan. And they've just been made permanent by HR1 over the summer. So Rhode Island has the resources to do this, and passing this policy would also make things more fair, our tax system more fair. Because as it stands, the lowest income earners in the state, people earning less than $23,000 a year, many of whom are elders, pay a higher percent of their state and local taxes. A higher percent of their income in state and local taxes than the top 1%. So
Yeah.
to repeat, the lowest earners in the state are paying a higher percentage of their wages in state and local taxes than the top earners in the state. So there's definitely room to make our tax system more fair and to get more of the revenue that we need to make sure that not only seniors and our families and individuals can survive, but also that our healthcare system doesn't collapse. Because when that much money comes out of the system and when that many people lose insurance, people are going to have to go to the emergency rooms. They could be overwhelmed. We already had Fatima and Roger Williams Hospital at risk of closure that we were narrowly able to avoid, but this is going to be a huge expense on hospitals if they have to provide so much uncompensated care. And the same goes for community health clinics and free clinics that are also going to be overwhelmed with the number of new patients. And that will affect all of us. All of us will see our healthcare premiums rise, as 40,000 Rhode Islanders did. And that was also as a part of HR1. You may recall.
And, I think you make a really good point about the hospitals, because I don't think that that's usually a big part of the day-to-day conversations in the community. And if you're not in the top 1%, but you're also not in the bottom percent, I think some folks feel like, what difference is it going to make in my life? I have the best Advantage plan, or I make more than 23,000 a year, so why does it matter to me? And the impact on lower Medicaid reimbursements on doctors' offices, so that if they're not going to take as many individuals who are covered under Medicaid, that means those individuals aren't going to have access to health care and end up in the hospital. And it also means fewer doctors practicing in the state. So no matter even cash in hand, there may not be a provider that has an opening spot available. And I think, we're kind of seeing some of that starting to pop up now, where we don't have a lot of doctors, or certainly not as many as we would prefer to have. That's for sure. So
Yeah.
if the individuals, if our older adults are, say, already in the nursing home, could they lose their coverage, or would they still be okay because they're already Medicaid eligible and they need that level of care? Would they be okay in this situation?
It's hard for me to answer that question, but as it stands, I don't think there's any law in place in the state that prevents a nursing home from putting someone out on the street if they're no longer eligible for coverage or can no longer afford to stay at the nursing home. Will nursing homes do that? I'm not sure, but I don't know that there's a law preventing them from doing so. And again, some of the first people to lose Medicaid eligibility are lawfully present immigrants. And some of them may be elderly. So there could be a situation where a lawfully present immigrant who maybe has been in the state for years or decades, but suddenly this administration has decided that they are no longer eligible for Medicaid. They could have been living in a nursing home, and it could very well be that without Medicaid, they can't afford to stay there and maybe put out. So that is definitely something that could happen.
My goodness. Yeah, I can tell you that nursing homes from a federal perspective, anybody, if you are not able to pay for your care, they can issue a 30-day notice of discharge and discharge. Are there opportunities with the long-term care ombudsman to fight that discharge? Absolutely. And if anybody watching is experiencing that, please reach out to the long-term care ombudsman. Their team are more than happy to be your advocates in that case. But when we're looking at this may happen for a lot of folks, particularly with Rhode Island being a state that we have had a large number of immigrants come, many of whom may have worked in our factories and retired and done everything the right way. And like you say, be here lawfully and now facing this. I think of our nanas and our pops and what that could look like without some advocacy around this.
Yeah.
So as we go forward, it's not just the Medicaid. I'm also seeing that this bill includes big changes to SNAP, sometimes called food stamps, and that those changes are happening, I think, starting a couple weeks ago, March 1st. What do those mean for older adults and caregivers and folks who rely on food assistance, especially when groceries are going up right now?
Right. Already, far too many people in Rhode Island are struggling to meet their basic needs. EPI publishes a report every 2 years, the Rhode Island Standard of Need, and it says that 68% of single adults without children can't afford to meet their basic needs without assistance. And so essentially, we know people are struggling already. We know that SNAP disproportionately benefits children. And what they've done with SNAP is remove eligibility for lawfully present immigrants. Again, that's a theme throughout HR1 is removing eligibility for lawfully present immigrants. And the second is these new administrative requirements of work requirements and reporting and more frequent recertification. And so anytime you add administrative requirements like that, it increases the likelihood that somebody could accidentally or erroneously have their benefits taken away. So especially, I think that's relevant for seniors who may have a more difficult time keeping up with paperwork or navigating online systems or accessing AI help. So it's definitely the case that as a result of these administrative requirements, people are going to lose their benefits, even if they should otherwise be entitled to them. And whether that's because they missed something or because DHS has to figure out how to manage all of these administrative requirements and create new processes for them, people will definitely lose benefits by falling through the cracks.
Wow. So I'm just trying to think of like some real life scenarios here. Maybe I'm 63. I have diabetes. My vision is not what it used to be because of the diabetes, but I'm not actually like blind. I just don't see very well. And I'm receiving SNAP because I've had a hard time, working. I've got some neuropathy. The fingers don't feel so good. I don't make a lot of money, so I'm on Medicaid. I would be an individual who would not only have to be able to like physically read, like see to read the renewal notices for the SNAP benefits and my Medicaid benefits more frequently now and really be able to pay attention. Is there any expectation on how that's like what resources are going to be available to help people who in the past 55 to 64 you were exempt from any work requirements and now you're not? Is there any help?
I know that
TBD.
TBD. I know that to my knowledge so far, what DHS has done is just send out letters. They could very well have a system in place for people like that example, for people who are blind per se. They may have a different system in place for reaching those people, although I'm not aware of it. What I do think is that DHS should increase their staff to ensure that people can get, especially seniors and people with disabilities who need assistance and maybe can't read or navigate systems, to ensure that they can reach a real human or go to a real address and get assistance. I don't know that that is part of DHS's plan right now, and I definitely think it should be.
You know, I appreciate that honesty. And, you know, we know Rhode Island has a fabulous history with updating computer systems and rolling out new programs. What can we do? Any Rhode Islanders who might be faced with these changes, what can we do right now that might help mitigate even some of the ripple effects? Maybe for community organizations, healthcare providers, even the local economies. Like what should we be doing right now to prepare for what's coming at us?
Great question. There's actually a lot of things. I know a lot of us feel stuck, but there are a lot of things people can do. Again, the first thing, as I said, is we need more money in the state to replace the money taken away. So you can call your state legislator or senator or email them or show up at the State House to talk to them and say, please pass the bill to tax the top 1%. We need a fair tax system, and we need to recover some of that money that the federal government cut. And then you can tell them what you want them to spend it for. If you're worried about home and community care, you can say tax the top 1%, raise this money so we can make sure that home and community care programs stay funded. Or so that we can donate it to free clinics and community health clinics so that they can expand their resources to provide uncompensated care for those who are losing health insurance. So that's one way I would say is contact your state reps and senators and tell them what's important to you. A second and more practical individual thing is if you are on these benefits, it's time to pay attention. Pay attention to your mail, make sure your address and contact information is up to date, make sure you're replying in a timely way to any requests for information. And then one other thing is that there are still some exemptions available for work requirements, at least for SNAP. So if you are a person who's newly subject to work requirements and you're, say, like that person you gave as an example with several medical issues that make it difficult to work, there are things called community exemption forms that you can have a social worker or somebody fill out for you saying that you're not really able to work in the way that would allow you to satisfy work requirements. So those are just some of the things I think people can do to get prepared. And lastly, I would say share this information. Learn and share this information with your neighbors, because I think information helps us dissipate fear and it helps us figure out our next step. And hopefully for people, some of their next steps will be to join the advocacy fight so that we can change the future of Rhode Island instead of accepting the fate that the federal government has dealt us.
You know, I think the other thing that is important too, when you talk about sharing the information out there and contacting your legislature, is a lot of times the conversation, whether it is the national news, the local news, the god-awful comments that can come in social media, is that we lose perspective that the people impacted could very easily be our neighbors. And the conversation often others, it's someone else, it's those people, fill in whatever blank you want to put under those. And the reality is, this is something that is going to impact everyone in some way or another. But when you're sitting down, you know, at Dunk's with your friends having coffee, and you find out that, you know, maybe that person is really expending most of their liquid cash on having that social connection, and they really need to go to the food bank because, you know, now their benefits are being cut. When we have these open conversations, it makes it easier to see the humanity in this, that it's not those, whatever person you want to fill in the blank. It's all of us. This is happening to all of us. And it's important. And again, EPI, you're a nonprofit, you're nonpartisan, so you're not saying red or blue, you're just power to the people.
Exactly. And thank you so much for highlighting how this affects everyone, because you're right. People hear SNAP and Medicaid and think if I don't have those, it doesn't affect me. But just to expand on the ways that this is so far reaching, is that money's coming out of the state budget. So even if you're not on SNAP or Medicaid, the state is going to have to balance the budget. So it could be that they cut some other program that's important to you, adult education or something like that, because they need to shuffle money around. Additionally, you mentioned the healthcare system, and we've talked about Medicaid, but one of the other things that Congress has failed to do is they failed to reauthorize subsidies that help people buy health insurance through HealthSource RI, our state marketplace. And so what that means is 40,000 Rhode Islanders saw their premiums go up. And right. And those are people who don't qualify for Medicaid. Many of them are small business owners. And on average, their premiums doubled. And it wasn't just them, because when people lose insurance or can't afford it, it's usually healthy people who leave the insurance pool first. And so when healthy people leave, that means the people left in the insurance pool are a little bit sicker, which means it's a little bit more expensive to provide their care. And what that means is health insurance rates rise for everyone in the state, not just people who are purchasing through HealthSource RI. And again, clogging and crowds of people in emergency rooms because they can't afford coverage is going to affect everybody, even if you have private insurance and you need to go to the ER. So, and if hospitals close, certainly that will affect everyone, because it won't matter how much money you have if there's no hospital to go to. And as you noted, we already have several other problems in our healthcare system. We were already kind of teetering on the verge of crisis. And without state action, like raising revenue to provide the needed funds, the healthcare system very well could fall into full-blown crisis, and that will affect everyone. And then just one more about SNAP. Even if you're not getting SNAP benefits, the loss of those benefits represents millions and millions of dollars that are no longer circulating in the Rhode Island economy, meaning that this is going to harm small business owners, small grocers. It's going to harm corner stores and places where people are usually going to spend their money, and it's going to overwhelm our food banks and resources that people have been relying on. So I could go on and on about collateral consequences, but this certainly will affect all of us in Rhode Island.
Yeah. And, when I talk about othering, the HealthSource Rhode Island and health insurance subsidies, I think it becomes really easy to say, oh, those people. But the reality is HealthSource Rhode Island provides the supplement necessary for the vast majority of small businesses where it is a family 2-person shop, or maybe 5 employees. HealthSource Rhode Island is what is enabling that company to get the insurance at a reasonable rate for their employees. And with those supplements gone, it has become a challenge for many, many companies, small nonprofits right here. It has an impact. Or if you are an individual who your spouse perhaps is older and had insurance through their job, but they became Medicare eligible, they retired, you no longer have health insurance. So now you're trying to buy it through HealthSource Rhode Island, and you're finding your premium just skyrocketed. And it's not, it's affecting far more people than I think we realize. And when you talk about the ripple effects, if you take those millions of SNAP dollars out of your local grocery store, whether that be, the big blue box store or the nice little basket or the place you stop at, those grocers are going to need to make up their money somewhere. They're not going to operate at a loss, which means prices go up to make up that difference of the lost SNAP dollars, which has the compound effect of raising the cost for everybody. And the people who lost the benefits can now purchase even less food. And so it just becomes a spiral. And I like that there is opportunity to make a change, to advocate for that change, to talk to our legislators, to reach out within our community. And if we have the capacity, I would say even make a donation to your local food pantry. You know, they've got something on sale, buy one, get one free. And you're like, I don't need two. Get the free one anyway and donate it. It doesn't matter if it's, you know, socks or toothpaste or laundry detergent. People, real people, if you need it, other people need it too. All of those things. But yeah, all of that. So if people have questions, how can they reach out to you?
So my information is on EPI's website as well as the rest of our staff. So people are welcome to reach out by email, and I'm often at the State House on Tuesdays and Thursday afternoons, so you can look for me there as well.
Awesome. I am so grateful. I know I said like 15 minutes and I've kept you like double that, but I appreciate this conversation so much. This is such an important conversation. And as things progress, will you come back on to talk about updates?
Certainly. I'd be happy to, and I hope they're good updates.
Yes, me too. They will be. They will be. Thank you so much for coming on today.
Thank you for having me.
Everybody, this is one of those things that is going to touch all of our lives in one way or another. And regardless of your personal beliefs, it's going to impact your life. So please reach out to your elected officials and make your situation known, make your beliefs and your feelings about this known to your elected leaders. If you are in a position to reach a hand out to help someone up, I strongly encourage you to do that. Many of us came together and helped each other out during the blizzard. We have a blizzard of change coming at us, and it's going to take all of us working together to get through this successfully. So I know that we can do this because Rhode Islanders, we're strong and we're good human beings. So I think we can do this. It's just going to take some work on our part. So I look forward to seeing you all again next week. I hope you have your tickets to our event tonight, our third annual Laughter is Ageless, for which we are so grateful to Brightside Health, Behavioral Health, for being our diamond sponsor. I hope to see you tonight, but if not, I'll catch you next week. In the meantime, be well and be kind.